We all know bad things can happen anywhere at any time. All safety threats are unsettling, but especially so when children are involved. The Rapid City Police Department, Pennington County Sheriff's Office, and the Rapid City Area Schools recently partnered to implement the Handle with Care program. The program is simple and effective. When first responders identify children at the scene of a crisis, a confidential email is sent to the child's school principal, counselor, teacher, social worker, and nurse, letting them know that the child may be in need of special care in the days following the incident. Only the child's name and date of birth is shared. No other information is provided about the student or the circumstances that triggered the Handle with Care alert. Educators won't question the child about what happened, act any differently toward them, or call them out for any reason in front of others.
I would say it's very common for educators, teachers, counselors, principals to work with students who have endured some sort of trauma in their lives. In my many years as an educator, I've worked with students who have seen violence firsthand, perhaps dealt with substance abuse issues in the home, witnessed some sort of physical or domestic violence. Really, it's startling how many ways our students do experience trauma in their lives, and that really impacts their ability to do well in school.
So after a teacher receives a notice that their child has been on scene at a potentially traumatic event, they're silent observers. They'll watch and see how the child is behaving and if there are additional needs, and really provide some grace and extra care and concern for that child, and sometimes choose to utilize the restorative options in lieu of punitive discipline if we know a child's just been exposed to trauma.
It's not unusual for teachers, police officers, paramedics, and firefighters to experience anxiety when the time comes to leave a child in crisis because the situation has been de-escalated or school is over for the day.
It's hard to separate the dad in me from the situations. It's those hang with me when those kids are, when they've seen something that you know is going to shape how they view the world.
A lot of the behaviors that we see from kids and youth, whether it be criminal behavior, depression, suicidal behavior, most of that's all coming from some sort of trauma. And the criminal justice system usually isn't the right place to deal with that. So I think a place that we can always get better is addressing the underlying issues of what's causing whatever behavior that's coming to our attention.
Prior to the Handle with Care program, we would respond to a crisis involving children who are affected by these situations, doing our best to ensure their safety while we're there, but never really knowing if the children were safeguarded. Now we have a process that enables us to reach out to the schools directly and alert them that one of their students has seen some of the worst our world has to offer, and that they may need some extra attention. It's simple, but it's powerful. It doesn't matter who you are or how old you are. If you are experiencing pain, caring people make all the difference in the world.
We are all very, very well trained in handling the emergency at hand. Up until now, there's been nothing in place, a system in place to follow up with the children. I think this program is very beneficial and as a continuity of care, as it were, for not necessarily the patient if it were a medical emergency, but those impacted by that emotional trauma.
The Handle with Care program is a lifeline, bringing comfort to some of our most vulnerable children without singling them out, adding to their sense of fear and uncertainty, or letting them fall behind in school. The Handle with Care program is supported by the Pennington County Fire Department, the Pennington County Sheriff's Office, the City of Rapid City Fire and Police Departments, along with Rapid City Area Schools. For more information about Handle with Care, please go to RCAS.org.